we have to make sure that who is the authorized person. Okay. So yes. Yeah. Yeah. So the record of the patient uh, standard. So can be decided by the national organization. If national organization, it can be decided by the usual hospital. It could be decided by the state if you are in the state government sector. Then depends on the availability of the funds and manpower resources. This is also important because uh, most hospitals have a limited number of staff, and if the patient has some government hospitals from all from government sector, private sector, all from government sector. So in government sector, generally the to patient ratio is 50:1. What kind of hospital ratio have? 100:1. Or like 50:1. And if you have 50:1, obviously you cannot do 1 hour leave for 50 patients. So that's a resource limit. So based on the resource limit, you have to the hospital management has to decide that maybe the nursing committee has to be there. They have to decide what is the practical doable thing, how much we can do. Then objective criteria for assessing adequacy of needs of the patient not determined as yet. Okay, so this is again the complex. One is how much we can judge, but the other angle is how much does the patient need. That is very difficult to judge because if you ask the patient, they will always say stand is being full time. It's taking my arm. So that is not possible. So we have to make some sort of a judgment. Then empirical evidence based on judgment of patients and hospital staff at the bedside is relied upon. So there is some psychology involved also. Some patients are more anxious, they want to stand here. Some patients are relaxed, जब time ले आ जा, so they can stay like that. Then what is the professional role? Nurses have the responsibility for the standard of care provided, quality of nursing care provided in the healthcare facility should be the concern of all nurses. That it is our responsibility to ensure a minimum acceptable level of nursing care in the community, and practitioners should be knowledgeable critics even if not practicing the profession. So it is our moral duty to take care of these things so that we have a good level of standard and we are able to provide. Now, objective of setting standard to bridge the gap between nursing education and the services to improve the quality of care. So, objective is very simple. We want to give better service. So, purpose evaluate quality of nursing practice in any setting. So, first is evaluate, second is compare with other people, and from present to past and the future, so we can have a continuum along the timeline. Then providing practitioners guidelines for quality of care and criteria for evaluation. Assist employers to understand expectations of employees. So management and staff, these people can have different expectations. So if we lay down the standard, then we have less argument to improve documentation system in the clubs and provide legal protection in practicing nursing. So there have been court cases in various countries where patients demanded that something went wrong, and if there were standards and those guidelines were followed, then they are saved by the court. Enough was done. There was no lacuna in the quality. Inform society of the concern of healthcare professionals for improvement of practice. To assist public to understand the expectations from nurses, identify areas for developing core curriculum for practicing nursing. So, from while laying down the standard, we also come across and we understand that there are some areas where we discuss and we writing it down. Gradually, something might happen. purposes, some examples of specific observable criteria for evaluating process standards are check patient identification before giving medication. So, patient safety is the heading, and in that the objective criteria will be patient identification, confirmed from minimum two different uh, data points. So you can ask the name, but same name can be patient is the same name. So we also ask the father's name or address or some other. What about asking for checking the patient ID? Patient ID. Do you have ID card? No. So what is your standard practice? Registration number. So we ask the patient after registration number. Can you remember that? By name and father's name or address, that is easier to remember. The patient can identify. Because number, if I get calls from some insurance company after policy number 176, stop. ये number मेरे को कुछ सुना रहे हो. I cannot remember this number. Same with patient. IP number is unique, but that number he cannot remember. So if you ask him, he will not be able to tell. So it is better to do by the name. Father name, wife name, husband name, address. That is easy. So two identification makes it more safe and explain the procedure. So this is the other example. So whenever we are going to do any procedure on a patient, it is less stressful for the patient if we explain what we are going to do. We are going to take a blood sample. We will give you an IV injection. We will give you oral medication or anything what we are going to do, we can explain. Now, otherwise, patient is having the fear of the unknown. क्या करने लगेगा? एक MRI के अंदर ले आते हैं, आ देते हैं मशीन इतना बड़ा फूक कर रहा है ना. A lot of people panic. If we explain to him, you take a photo and you light quietly and थोड़ा सा आवाज होगा उसके बाद आपको दे जाएंगे. कोई आपको इंजेक्शन नहीं होगा, कोई will not have any pain. ना so then it is more comfortable. So the explanation of the procedure is a objective criteria for a standard. All procedures will be explained to the patient before starting the procedure. Then normative standards. So there are different types of standards. So we have understood what is the standard, why we need to do it. Now, what are the types of standards? So there are normative standards and empirical standards. So what are the normative standards? Their description of practices considered good or ideal of the highest quality. What is the best practice? So recruitment standard of nurses. So recruitment standard, we lay down that nurses should be qualified minimum for a certain level of employment. ENM, certain level maybe ANM, certain level maybe BSc nursing, certain level maybe MSc nursing. So we can lay down the standard. What are the qualifications? What are the experience requirements? And maybe for certain specialized types of things, we can lay down further criteria. OT nurse, experience in OT. Cardiothoracic OT nurse, experience in cardiothoracic OT for 3 years, having done assisted in 50 for heart surgery. We can lay down specific criteria like that. So that's the recruitment standard. Once we lay down the recruitment standard, we will have better quality of care for the patient if those kind of will be improved. Then empirical standard, description of actual practices agreed upon and achievable in large number of patient care unit settings. So standards by law enforcement or regulatory bodies like lab. So this is the things which are laid down the nursing council. Nursing council has certain criteria on the recognized medical college and have passed. So that is empirical. Then frame of reference. So what frame of reference is about what kind of standard. So the kind of standards are structural standards that talk about the building, the infrastructure, the equipment. So that all comes under structure. What all is required? That is under structure. Process standard is how we are going to do. How? What is the method? And then outcome. Outcome standard is how many patients recovered, how many patients had faith, how many patients had infection, so things like that. So what happened to the patient after they were handled by us and after they came out of the hospital? Then what is the score? We go for a cricket match and we have what is the score? Football match, Bengal match, football match, what is the score? So outcome standard is what is the score? How many patients were happy? How many patients were dissatisfied? How many patients were infection? Then the structural standard. Now we understand each one in a little more detail. So structural standard focuses on the setting in which care is given, institution oriented and relates to the care provided system and resources that support for access provision of care and include physical facility, the building, policies, goals and objectives, staffing. So staff is also a resource. So staff also comes under resource. Qualification, type of staff, training, job responsibility, availability of equipment and supplies, consumables also come under this administrative setup and channels of communication, budgeting. That's very important. Very often we have problem with the budget because the budget will provide all these other things. If we don't have budget, we cannot employ people, we cannot buy the stuff. If we have the proper budget, then we can do all the work. Describe what effect the setting have on quality of care. So this would be the question which will be answered by all. Criteria that need to be written include. So when we are writing down the standard, for structure, we can write down things like call, the light of the call button should be within reach of the patient. So if patient is lying on the bed and the call button is on the wall and patient is unable to get up, then stop. So we can lay down the criteria. There will be a bed switch which connects to the wall outlet and we put on the patient bed. So then that becomes the part of the nursing duty to go and check that the switch is not hanging there. It is put on the patient bed. It is put in his hand and he is told whenever you require. Doctor bole belt awaja. And he told him like that. So then that instruction makes the thing complete. If you have the bell hanging there, if you put the bell on the bed but you have not told him when he lying, he does not know what to do. Then again, you have to give that complete thing. Put it on the bed, put it in his hand, show him this is the button, and you have to press the button, and he will hear bell ring, and then he knows if this is a call bell, and then you pick off in front of it. Then he understands the whole cycle. Then when he is required, he will pick. So if all that thing is done, then we take this full mark. Narcotics kept in locked cabinet. So that is the legal requirement. Narcotics